Basically, my message is that Pharmacare costs less and helps more people, and we saw lots of evidence of that yesterday. I've been asked, and we've all been asked to talk about a vision for the system and goals and what kind of vision would undermine and underlie those goals. I want to start with the foundation of values. So much like the Romano Commission that said that basically Canadians see healthcare as a moral enterprise, not a business venture. So our values and the values of the vast majority of Canadian citizens are rock solid in terms of their views of healthcare. It's seen as a public good. It's a human right. And this means that one of our top goals is to keep people healthy in the first place. And so our policies should be geared to that and not just dealing with people after they get sick. The other goal, of course, the ideal is to have an integrated system and to have teamwork. We train our healthcare professionals to work in teams. And we want an integrated system. That's one of the big problems when we have a big part of important part of healthcare not included in the insurance system, which is pharmaceuticals. And the other value, of course, is to protect the vulnerable. This is really strong, and I know that the healthcare professionals have a strong commitment to these values, that we protect the vulnerable, especially the frail elderly, especially children, and especially the sick. But we have conflict in terms of values. There's another set of values in direct conflict with the dominant values of healthcare as a public good. And that is healthcare seen as a commercial commodity. Nowhere more dramatically illustrated than with pharmaceuticals. And the value there, of course, is to profit from illness. No pharmaceutical company is in the business of keeping people healthy or preventing illness. It's profiting from illness, and they do a very, very good job at getting profit from illness. The other goal in a commercial set of values is to fragment healthcare into pieces and concentrate on the pieces you can make money off of. So you concentrate on body parts. We'll do your hip, but we don't want to see you if you're a seriously ill patient. So you have specialized clinics like Brian Day's in Vancouver. They'll only take the healthy and the wealthy and only treat profitable body parts and procedures that can make money. So you've got the fragmentation, and you've got the other value being competition as opposed to teamwork. And then finally, this conflicting set of values exploits vulnerability. So instead of protecting the vulnerable, you actually target the vulnerable. And nowhere more dramatic illustration of this is pharmaceutical advertising on television. Exploit vulnerability. Let's exploit desperate, terminally ill cancer patients to try to sell them or get them to pressure governments to pay for extremely questionable experimental cancer treatments. That's exploiting vulnerability. So before we lay out, or before I talk about the goals of a healthcare system, obviously there's a problem, which in a way is why a lot of us are here today. What is the problem? Canada has a drug problem. 8 million Canadians can't afford access to the needed medicine. And as Marc-André Gagnon and others have affirmed yesterday with strong evidence, that we're paying 30% above the international average for our drugs. Another, in a sense, an elephant in the room is there's an annual estimate of 220,000 hospital patients have had serious adverse drug reactions and 10,000 deaths per year. That's the estimate for Canada. That's 4th to 6th leading cause of death. And of course, related to this, I think, directly, is that drug use, prescription drug use, is driven by advertising and not by evidence. So I think one of the really important goals that comes out of these sets of values that I've been talking about for Pharmacare is that a Pharmacare system, a universal public Pharmacare system, should cover everyone. So universal access is an obvious goal that reflects these values. Cover everyone, but don't cover every drug. We've seen reasons why. And here's a headline from The Guardian not long ago. Half of drugs prescribed in France are useless or dangerous, say two specialists. And of course, we see this, even the PMPRB's annual reports show that more than 75% of new drugs are useless. But what they don't say, in which what Prescrire says in France, is that a lot of new drugs are not just useless, they're actually extremely dangerous. So just very briefly to summarize what components of a universal public pharmacare plan, we've heard yesterday, and I think there's consensus, we need a national formulary, we need to bulk purchase, negotiate competitive prices. And here is real common sense. Pay for what works. Pay for the drugs that are safe and cost-effective, and improve prescribing practices. So I want to put a plug in for Marc-André's report, the economic case for universal pharmacare. It's compelling. It's universal, it's safe, and there's cost controls. I just also want to just end on the whole issue of the values again. There's an old Jewish saying, I think, from the book of Proverbs, and that is, the people will perish without a vision. And that's very, very true in democracy, and it's true in our healthcare system as well. It's time for universal pharmacare, and let's get on with it. Thank you.